I'm Aaron Lee, and if you're anything like me, you've probably seen one of these weird supplement sales pitches as either promoted video or on your FYP. Some of them make outrightly spurious claims, like this one where the creator tries to claim that no one should be taking folic acid, while of course showing a very similar product on their own website.
More serotonin for depressed people, making sure neural defects are better, and
others just make straight-out outlandish claims about mysterious vitamins making you taller and better at sports. Others pathologize generally nonsensical statements.
Thesis. Of course we stopped doom scrolling on TikTok. We take thesis.
While others make overarching statements that can't possibly be true for everyone, and then go on to make unprovable claims.
3 supplements every man should take for longevity, energy, and testosterone. Number 1 is...
And well, I'll just let this one speak for itself.
Not everybody is born with a large schlong.
All these videos have a few things in common. They each make claims, they each recommend a supplement or supplements, and they each direct you to a supplement or supplements that they want you to buy from them. But that's not all. All these videos are also missing something. If you've ever watched network or cable TV for any length of time, you've probably seen an ad like this.
Health is not a sprint, it's a marathon, and you know that.
Let's pause here. You'll notice something important appearing at the bottom of your screen. Here, I'll blow them up in case you missed it. These 2 disclaimers are a staple of supplement advertising, and in fact appear on all supplement bottles as well. There's really good reason for that. They appear because they're required to. Supplements exist in an odd place in the US. Because of years of lobbying, the supplement market is left essentially unregulated, while regulation does exist, is relegated to 2 government agencies, the US Food and Drug Administration and the Federal Trade Commission. While the FDA is charged with ensuring that supplements aren't outright poison, although importantly they can still be harmful, and their enforcement ability is incredibly limited. It's the FTC that's charged with truth in advertising. Because of the aforementioned lobbying, supplement manufacturers can get away with a lot as long as they have some cursory scientific basis and use the magic words. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. That's it. And as with the FDA, their enforcement ability is incredibly limited. Let's say, for example, that I wanted to create a supplement. Aaron's Miracle Eye Vitamin for blindness prevention. I looked through scientific articles, cherry-picked some that purport to prove my point, or better yet, I fund some. Take those active ingredients, dilute them to whatever strength I want, in some cases a very small amount in the whole bottle, add that disclaimer, mass-produce and advertise it. Assuming I meet the relatively low hurdles of basic licensing and making sure that it doesn't contain rat poison or something, although treating with actual drugs like the active ingredient in Viagra seems to be largely fine, as an inquiry found that between 2007 and 2016, 776 dietary supplements had been found to be adulterated by the FDA, and yet only 46% were recalled, and of those recalled, many of the supplements continued to be sold despite the recall. As long as I have those things, I'm free to market this in the US and sell 1 million bottles of essentially nothing. If I want an even better racket, I can dilute it even further and have it be actually nothing. Literally no active ingredients in the bottle you receive. I just have to call it homeopathic medicine. That is to say, these requirements are incredibly easy to follow, and the supplement industry is clearly thriving despite the fact that it's mostly completely bunk. This makes it even more flagrant that these accounts aren't including the simple fine print warning required by law. 21 U.S.C. 343 R6C and 21 CFR 101.93B through D make it illegal to fail to include those disclaimers, and yet neither TikTok nor the FTC is taking any action against these offenders. In the month of January 2024, I reported a total of 22 videos for violating this disclaimer requirement, each cut and dry cases. TikTok removed only 4 of them, claiming no violation was found for 9 of them, and leaving an additional 9 still marked under review, which is unlikely to change since I have similar reports that are months old that still remain in this under review status. This means that in cases of actual crimes, legal misconduct, false advertising, TikTok has failed 81% of the time to protect its users. In a market where manufacturers are left unchecked, these disclaimers are all we have to protect people who aren't health experts. And while long-term, these rules must change to better protect consumers, a good start is enforcing the ones we already have.